prescription, okay, or prescription writing. Prescription is derived from the Latin word prescripto. Pre means before, scripto means write. Okay, scripto, right? Okay, so just before write. Okay, prescription writing is prescripto. Pre means before, scripto means script or to write. Okay, a prescription is a written documentation order given by a physician to a dispenser for preparation of required medicine as well as instructions about the mode of intake for a particular patient at a particular time. Okay. A prescription is a written document order given by a physician to the dispenser for preparation of required medicine as well as instructions about the mode of intake for a particular patient at a particular time. Okay, so this is the definition of a prescription writing. Timing, okay, means at a particular time, at particular patient, okay, you are giving something, okay, in properly written form, okay, that is called as a prescription. Prescription is a part of professional relationship between the prescriber, pharmacist, and the patient. Okay. Prescription is a part of professional relationship between the prescriber, that is the physician, pharmacist, dispenser, and the patient, consumer. Okay. That is there. It is the pharmacist's responsibility to provide the medicines needed for the patient. Pharmacist should maintain the trust of the prescriber and the patient. Okay, means he is the dealer, or he is in between person between the physician and the patient. So he should be honest, or he or she should maintain the proper honesty on the part of giving medicines or dispensing the medicine to the patient. This includes maintaining confidentiality. Okay, because this prescription writing process is just related with the confidentiality. Okay, because you cannot tell your patients uh, things to other persons. Okay, and you can just not make it like a keep just advertisement. Okay, you have to take consent from your patient. Form of the prescription. Prescriptions are usually written on printed form, usually in the form of a pad or imprinted with the name, address, telephone number, registration number, and other relevant informations. Prescriptions are usually written on printed forms, usually in the forms of a pad and imprinted with the name, address, telephone number, registration number, and other relevant information. Okay, already we will discuss about this. Okay, which part will contain all the things. A complete prescription must consist of the relevant information in definite order. Okay. Name of the patient, age and sex with address. The full name and address of the patient is necessary on the prescription. The physician should place it at the top of the prescription and should be transferred to the label by the compounder for identification purpose. The word for is written before the name of the patient. Okay, RX, and after that for. Okay, it should be there. Okay, just I will give you example. The symbol RX. This symbol was originally employed as the sign of Jupiter. Remember it. Okay, this sign was originally employed as the sign of Jupiter. Okay, are you getting it now? What I am telling? Are you getting it? Hello.
Yes, sir.
Okay. This symbol RX, this sign was originally employed as the sign of Jupiter. Okay, means Jupiter at that time is worshipped. Okay, and in Hindu mythology also it is called as a Guru. Okay, Brihaspati Guru. Okay, so like that. Okay, in different religions it was the Jupiter was worshipped. Okay, so just this is was on that. Okay. It is now used as an abbreviation for the Latin word receive. Okay, receive. Name of the remedy in potency and its quantity. The name of the remedy together with, okay, its potency in the description scale is written in the part of the prescription is that order the quantity of the medicines as well as its form is also noted. Okay, it is actually inscription part. Okay, first part is the superscription. Okay, remember it, superscription. This superscription part contain the details of the patient. Okay, name, age, sex. Okay, then related with complaints. Okay, superscription. Okay, after that superscription you have to write the inscription. Okay, inscription part contains the quantity of medicine what you are giving and its potency. Okay, then just one part is superscription, then inscription. Okay, these are the parts of prescription writing. Okay, then nature and quantity of various vehicles what you are using. Okay, that is also a part of inscription. Name of the remedy which with potency and its quantity should be written first, and then the name and quantity of the vehicle is written. Okay, so that is under the inscription part, superscription, inscription. Okay. Then subscription, third is the subscription part. Instructions and direction for the dispenser. Okay, who is dispensing or who is taking medicine for them. The directions are there in superscription. Inscription, subscription. Okay, so superscription, inscription, subscription. Third part. Okay, the part of the prescription contains the directions to the dispenser or pharmacist regarding the mode of preparation of the doses from one of the medicines described by the physician and dispensing of the medicine with the vehicle. Okay, so this part contains the superscription, the subscription. Then signature, last part. Okay, superscription, inscription, subscription, and signature. Last part is the signature. Okay, directions to the patient, signature or signa means making. Tau should be short, simple, comprehensible, complete regarding the mode of intake, route of administration, and the time of intake of the medicine. When to report, all these things should be written. Okay, when, after follow-up, when the patient should come. Okay, this will be in signature part. Okay. Then advice regarding the diet and regimen, what the patient should take after with the medicine and what they should avoid. Okay, all these things should be there. Any other instruction of the cautions to the patient. These directions are to be transferred by the pharmacist onto the label of the container of the dispensing medicines. Okay, means this part also they can write on the medicines label. Okay, instruction and other things also. Okay, in the prescription pad also it should be there, and it should be in the this dispensing bottle also. Okay. Then signature of the physician with date and registration number. Okay, that is important. Okay, signature of the physician with date and registration number. Okay, that is important. Okay, the signature of the physician with his registration number from official registration authority is essential, as this makes the prescription valid and authentic. Okay, signature and registration number is needed because to just make the prescription authentic. Prescriptions are dated at the time they are written and also when they are received and filled in the pharmacy. The date is important in establishing record of the patient. Okay, date is important for just you have to keep the record of the patient. Okay, what you have prescribed. Okay, what was the total your rules regulation you have followed or not, for all these things. Okay. Then prescription guidelines. Okay, there are some other important guidelines. Okay, just we have discussed about the parts of the prescription writing. Okay. Superscription, inscription, subscription, and signature. These four parts are there. Okay, but there is some guidelines. Okay, these guidelines are important. Okay, must always be written in definite pattern. Okay, you have to write your prescription in proper pattern. Okay, normally it is told prescription should be in the capital, okay, and clean handwriting. Okay, it should be in capital letter and clean handwriting. Okay, should be legible and neatly written so as to easily interpreted. Okay, it should be properly just this pharmacist can read it properly, or the patient can also read it properly. Okay, it should be properly informative and it should be cleanly written. Okay, information should be complete, accurate, and unambiguous. Okay, means it should not be mixed, it should be properly clear, advice should be there. Okay, physicians should avoid prescribing inimical and unhomeopathic medicines. Okay, for a homeopathic physician who is registered in any homeopathic council, they should have to write only and only homeopathic medicines in the prescription pad. Okay, and just they can advise some other things. Okay, well, like alternative things. Okay, like they can prescribe good diet, they can prescribe good, just ask them to do yoga. Okay, all these things. Okay, like morning walk, evening walk, all these things they can tell to their patient. Okay, physicians should be avoid prescribing inimical and unhomeopathic medicines. Okay, may be written in simple form or in Latin. Okay, prescription should be normally this time it should be written in simple form, because nowadays nobody is able to understand the Latin format. Okay, then use of Latin abbreviation is mainly in subscription and signa portion of the prescription. Okay, that we will discuss when we will just read the or understand the these parts. Okay, like the abbreviation part. Okay, nowadays prescriptions are frequently written in English. Okay, because this is like a universal language, so most of the persons can understand the English. Okay, and our medical science is also in the English form. Okay, so that the prescription is normally written in English, so that patient can also understand, and from each one doctor to other doctor or pharmacist they can understand. Okay, so that's why this is in English. Okay, the argument for the continued use of Latin or pharmacist is all countries understand it. Okay, that is the reason. Okay, means previously it was used Latin, but nowadays it is problem. Okay, Latin forms a healthy shorthand for the busy practitioners. Hence, Latin names are used for the directions to the dispensers. He must write the directions of the label either in the English or in the local languages, but the doubt written in simple form. Okay, so that small handwritings what is already prescribed for the medical languages. Okay, like RX 2x, okay, BD 2 times a day, this should be used because this is universal for all over world. Okay, then hospital prescriptions. In hospital, principles underlying dispensing for outpatients are essentially the same as those in the routine dispensing. The main difference is that the length of the time and duration of the treatment is specified rather than the actual quantity of the medicine that is to be supplied. Okay, the patient, it should be specified to patient for how long the treatment should be there, how much medicine you are giving, everything should be cleanly written and it should be advised to your patient. Okay, then for inpatient supply of the drug in hospital has a different part of the dispensing. Okay, because that inpatient, when patient is IPD patient, okay, inpatient department. Okay, so at that time dispensing part is the part of the nursing staff. Okay, so the nursing staff they know, okay, that things, and they can properly give the medicines to the admitted patient. Okay, prescription for inpatients are written on in a patient case record under the follow-up record and on a sheet where the daily record of the medicine administered to the patient is kept. This is called as a physician order sheet. This is done is sent to the hospital pharmacy for the dispensing. Then name and strength of the dispensing medicines should be recorded on the prescription labels unless otherwise directed by the prescriber. Whenever possible, specific time of the day of the drug administration should be indicated. Okay, everything should be clear. When to give the medicine, when to prescribe, and in how much potency it should be prescribed. Everything should be clear. Okay. Use of the potentially confusing abbreviation should be discouraged. Okay, which type of abbreviations, okay, short form which are used, okay, which are not like in regularly used, okay, that type of thing should be avoided. Okay, so that the pharmacist, nursing staff, they can properly understand what the physician is writing. Okay, vague instructions that are confusing to the patients are to be avoided. Okay, vague instructions should not be given. What instruction should be given to the patient or to the nursing staff or to the pharmacist, they should be properly cleanly written in the prescription. Okay, metric system of the weight should be used. Okay, weight like potency, weight, that should be properly used, which are normally in used or which are in concern with your medicines in your pharmacy. Okay, Then guidelines for the dispensing, okay, pharmacies, okay, who are dispensing for them, some guidelines are there. A prescription should be received without any discussion or comment over it regarding the merits and demerits of the therapeutic efficacy. Okay, sometimes it happens, many pharmacists, okay, they just want to become doctor, okay, means what they do, they just what is prescribed by the physician, okay, they just contradict on these, or they just tell the patient something else, okay, this should not be there, okay, what their duty, they should be, they should perform it, okay, means what physician has prescribed, they have to give that medicine to the nursing staff or the patient, okay, and they should not tell any type of confusing word to the patient, okay, they should not just bring any confusion in the patient mind, okay. The pharmacy should not add or omit or substitute the composition and nature of the prescription without consent of the prescriber, means physician, okay, means they should not do any type of editing in the prescription of the physician, because only the physician has right of prescribing, okay, because the physician has registration number with the concerned pathy, okay. Then pharmacy should also indicate the label, name, address, telephone number of the pharmacy, okay, means when they are prescribing, okay, if outpatient department, okay, in the bottle or in files, they should properly write the name, address, telephone number of the pharmacy from where the medicine is dispensed, okay. Directions for the storage of the dispensing medicine should also be mentioned, okay, means how to store the medicine at home, okay, that should be also properly written in that, okay, instruction should be there, okay. One example is there, okay, the example how the prescription writing should be there, okay, so just this example is written with the different parts, okay, like superscription, inscription, subscription and signature, so how much part is superscription, subscription, all these things, okay. So like, okay, just 001 is the example number one. Okay, here it is written for, okay, and before that RX is written RX. Okay, so RX, it is the like part of a prescription pad. Just understand it like a part of prescription pad. Okay, RX for Mrs. ABC. Okay, because when you are just doing any type of research or any type of monitoring, you don't need to reveal the name of patient, okay, it is unethical, okay, or otherwise you are just revealing the name of your patient, you have to take a proper consent from your patient, okay, and it should, proper consent should be there, okay, like Mrs. ABC, age 35 year, B205 at Leafy, okay, Lokhandwala, Mumbai 53, okay, this is the address, total address, okay, age, name, age and address, okay. Then treatment part RX, okay, so till here is the superscription, okay. Now in treatment part, what is given, okay, treatment part, mug salt 200, 2 drops distilled water, okay, this part is the inscription part, okay. Then mix and stir well, put, okay, 6 marks, okay, this is subscription part, okay. Then last part is the signature part, to be taken every 2 hours on empty stomach, stop when improvement starts, have a liquid diet, okay, report tomorrow, okay, like that. So RX, Dr. XYZ, okay, BHMS, okay, then registration number, then date and signature of doctor, okay. So this is part is the total signature part, okay. So this much is there in the this PowerPoint of this prescription writing, okay. So if you have any doubt, you can tell me, okay. Sneha, you have any doubt?
Sir,
Hmm.
no.
Vishal,
यस सर।
any doubt? कुछ पूछना है?
नो सर, ये पूछ रहा था सर, ये 4 स्टेप है, उसमें से मोस्ट इम्पोर्टेंट स्टेप कौन सा होगा?
Superscription, inscription, subscription and signature, okay.
Yes.
So this most important part is the inscription part, because okay, superscription, inscription, okay, because at that there you are prescribing the medicines, okay.
Yes.
So that part is important. Okay, we will discuss about all these things in the concerned chapter. Okay, because it is not complete. Okay, this is just PowerPoint. Okay, we will complete. Okay, many important parts are there, so that we will discuss. Okay.
Okay, sir.